Thanks so much for having me on. My name is Megan Jacobs. I'm the Senior Vice President of Product here at Truth Initiative. And I'm very excited to be here today talking with you about X program, which is our cessation program for youth. And oh, I'm going to be screen sharing my presentation here, which hopefully we'll all be seeing in the right mode. It's always a fun adventure with presenter mode. So please do let me know if what you're seeing looks like presenter notes instead of a full screen view. All right. Everyone seeing good things?
Yes.
All right, perfect. So just a quick review of what we'll be talking about today. I have some disclosures, of course. I want to share a brief bit about Truth Initiative's recent transformation for those of you who may not be as familiar with our current state of affairs here as an organization. And then we'll get into how X program engages young quitters and how we reach our audience. Just to note, as I said, I am employed by Truth Initiative, and we receive funding from an array of different sources, which you can read here on this slide. And all of those contributions support our mission-driven work to prevent youth and young adult nicotine addiction, empower quitting for all, and support other mission-based activities. We do not accept any funding from the tobacco or e-cigarette industry. So many of you may be familiar with Truth Initiative and the role that we've played over the last 25 years in tobacco control. We've historically had a huge presence, of course, in youth prevention through our Truth campaign, but have also done a variety of work around treating people across the entire age spectrum to help them quit nicotine and tobacco products, as well as doing a variety of youth advocacy, policy research, intervention science research, and training the next generation of scientists in tobacco control. Over the last 18 months or so, we've been on a great endeavor to redefine our vision, mission, and strategic plan to lean into those successes and what we've achieved, but also really prioritize certain demographic groups that are the most at risk for a lifetime of addiction, follow the data of what tobacco use prevalence rates are, really understand where we as an organization can play a unique role in supporting the state of tobacco control, and of course, looking at our core competencies as an organization. And so to that end, you may have seen some new branding from the organization, a new tagline, freedom from nicotine addiction, and really an emphasized position as it relates to youth and young adult tobacco cessation, as opposed to historically the prevention focus that we've had as an organization. We know that young people who use nicotine want to quit. Roughly 60% of young nicotine users make at least one quit attempt a year. But unfortunately, they typically choose the most miserable and least effective way to do it, which is to go cold turkey, which we know really does not work very well. Of course, those of us who work in public health may not know the exact statistic, but the relapse rate going cold turkey without using any evidence-based support is roughly 95%. What young people see in their constant social media diet are usually quick fix hacks, different tips and tricks, one weird trick that make quitting seem very easy or like it should be something that they could do easily. And then when they're confronted with the reality of how difficult it is, it can feel very defeating and demoralizing. At the end of the day, we see that only roughly 1/4 of young adults use evidence-based methods to quit. And this leads to young people getting caught in what really can feel like a never-ending cycle of ups and downs, of trying, failing, going back to using, making another quit attempt, that, again, can be demoralizing and also lead to pretty devastating physical and mental health consequences. And so over the past year or so, we have been working very hard and diligently as an organization to create a unified cessation program called X program to combine the two powerful quitting programs that we've historically had as an organization. This is quitting for teen and young adult vaping cessation, as well as X, or Become an X, that we've historically had to support adult tobacco users into one powerful program that can support all types of tobacco users, no matter what type of tobacco they're quitting or where they are in their quitting journey. X program is a program that we develop with Mayo Clinic. We work very closely with our clinical partners at the Mayo Clinic Nicotine Dependence Center, and we have since 2008 to support millions of tobacco users on their quitting journeys through a combination of evidence-based quitting approaches that we deliver through a variety of digital modalities, as well as the most established quit community anywhere on the internet. So I say we have one program with many ways to engage. X program centers on an interactive text messaging experience that is complemented by a highly dynamic and interactive website with online community, a variety of different content in the form of long format articles, as well as short blog posts that are authored by Mayo Clinic, interactive tools to help people learn skills for coping with cravings and nicotine withdrawal, learning new ways to get through life without tobacco, a variety of video content, and then tailored email support for those who choose to receive it. Through this newly designed X program, we can serve all types of tobacco users ages 13 and up with a richer feature set than we were historically providing through This Is Quitting, which used to be just a text message intervention that was, again, exclusively for quitting vaping. I'm going to walk through 3 of the cornerstone features in a bit more detail, just so you get a more thorough understanding of how the program works. Our interactive text messaging is anchored in the This Is Quitting experience. So for those of you who are familiar with it, our text message interventions tailor on a variety of different features about a user, including what type of tobacco they're using, where they are in their quit journey, their age, and then new features of X program text messaging, again, which is anchored in This Is Quitting's voice and tone, its style, the way that it brings to life messages like you can see here on the right that come directly in the words of other young people that are going through this program. We now also dynamically tailor the program based on how they've used it. So we know, for example, if a user has visited the community or not, or what their triggers are. They can interact with all the interactive web-based tools that X program has to offer through text messaging. And we're able to then dynamically tailor text messages to provide germane and meaningful messages based on where a user is in their journey. We have a variety of partnerships. So for example, we're referring users to Crisis Text Line for enhanced mental health support and to breathwork for additional guided breathing exercises and new stress management techniques. And we make it super easy for young people to sign up for X program. They can register by text message by texting X program or another one of the keywords that we promote to 88709. We also have dedicated web forms and QR codes that we make available through a variety of different sources. I mentioned our X community as the longest running, largest cessation community anywhere on the internet. It's a place where people of all ages can connect with peers who are going through the quit journey right along with them, as well as peers who are already on the other side of it, who have gone through the quit journey and stick around the community for sometimes a decade or longer, just to help people go through that journey and be successful. They can also connect with experts, our Mayo Clinic experts and other X coaches who are certified tobacco treatment specialists, participate in the community. And we put on a variety of different virtual events to engage with users in different ways beyond just the community forums. Our research has demonstrated that even just reading in the X community confers quitting benefit, and the longer someone is engaged with it, the longer their abstinence is likely to persist. So it's a really special place on the internet. We have incorporated a variety of different moderation and specific platform features to keep teens feeling safe and supported. So we want to make sure that all of our users, no matter what age they are really having a positive experience in the X community, and our community staff moderation is a key element of doing that, as well as some platform features that we rely on, such as not allowing teen users under 18 to exchange private messages with other users. Finally, our X plan is the dynamically tailored web experience that centers a user's experience in the program. This is also customized to the individual. We have a proprietary recommender engine that we've built at Truth Initiative that serves up content recommendations as part of ultimately what is a self-guided journey. We don't gatekeep content. We don't require users to set a quit date, but we do provide structured recommendations for users who want that as they're going through the program. This is an entirely mobile-first experience, but it is not a mobile application that a user has to install. Rather, they can come to xprogram.com, sign up with just a phone number, they can log in with just a phone number, and the whole program is mobile optimized. So it feels like an app when you're on it, but it doesn't require users to install anything. So once we had done a pretty comprehensive rebranding on the visual design and incorporating what had been This Is Quitting as a separate text message program into this newly designed X program, we then went to work crafting our campaign and media plan to get X program into the hands of young adults who need it so desperately. We have three key campaign components. There are traditional ads. These are highly produced. We work with hired actors to build brand awareness. Then we work with creators, which some people think of as influencers, but I understand creators is the new term of record to drive enrollments and engagement. And then we also have our own, what we call own social, or our @X program on TikTok, Instagram, and YouTube, because no brand is really a brand right now without a social media presence. And this is just another way for us to engage and gain some free reach, as well as some evangelical, social sharing. Our creative objective for the current campaign, called Outsmart Nicotine, was to bust the myth that quitting nicotine solo and cold turkey is the best approach. And in a world where quitting can feel endless, we want to show Gen Z that it's smarter to start with an evidence-based program. Smarter to start with X program. So this is a variety of what our traditional ads have looked like. Our Outsmart Nicotine campaign launched in December with an ad that introduces X program and really shows young people a variety of circumstances that probably feel very familiar to them of how they may have tried to cope with cravings in the past. Then we work with a variety of different creators. Some of them range from ones who have very small niche audiences. Others are much bigger. You might recognize some of these folks, including Alex Warren, RuPaul's Drag Race star Katya is one of our current creators that we're working with. So a variety of different creators who have really broad followings across different types of demographics that allow us to reach and engage users that our traditional ads might not otherwise get in front of. Finally, through our own social, we really span a gamut of content ranging from more earnest, a little bit more sort of sympathetic, we understand what you're going through, we've been in your shoes, to things that are more humorous. We know that those engage users in different ways. And again, we want to show up as a brand for everyone, no matter where they are in their quit journey. We post a minimum of 4 times a week with different videos that are created by our in-house team. And we add some media dollars to boost those posts to our target audiences. Just to give you a little feel of what these look like sometimes. So, I don't know what's happening with the sound there, but just give you a little flavor of what that content looks like across a variety of different types of content. And you can, of course, go visit us on X Program Social, whatever channel you happen to be on. I want to stay conscious of time and make sure we get to the end here, because I know that lots of people say, okay, great, but what's the impact of it? So I want to share what we're seeing since our Outsmart Nicotine campaign launched in December of 2024. In terms of reach, we've been really thrilled with how we've been able to get in front of young adults' eyeballs on the internet. Over 3.4 billion impressions or views, 58% awareness, which means 58% of people in our target demographic remember the campaign and can recognize it. 630 million video views, 4.6 million social engagements. That covers our owned content as well as creators on social, and 5 million visits to both our campaign landing page and our homepage combined. So these are 5 million young people who are at least now aware of X program as a program that can be there to help them, even if they're not ready to sign up yet. But luckily, many of them are, and we've enrolled over 105,000 teens and young adults since we launched this campaign in December. The program itself is driving very meaningful engagement with roughly 72% completing the text message program, meaning they stay enrolled for at least 60 days or more. Almost a third of them are adding web experience, meaning they're going to the website at least once, and 90% of the ones who do actively engage on the web. We've learned a lot about our tobacco users that are using this program, namely that they need help, they need support, they're struggling with cravings, alcohol is a big trigger for them. Generally speaking, they don't have super high confidence to quit, and they struggle with mood and stress. And so we're very grateful to be there to support them. Since the campaign launch, we've been doubling our membership in the community from what we've historically seen as monthly trends, which is amazing, getting lots of young people engaged in that evidence-based resource. And we can see in their own words how much this is helping them. It reminds me I'm not alone, makes me feel like someone's there with me. I love that they remind me why I'm quitting. It makes me proud, right? So things that make us really proud as well. From a quitting outcomes perspective, we see that nearly 40% achieve at least 7 days of abstinence, 22% reporting achieving 30 or more days of abstinence using the program. So we're seeing X program as an effective program that's having really broad reach with great overall impact. And I'll be on this panel so I can answer questions, of course, but here's my contact information if you have additional questions or you want to reach out about ways that you might be able to bring X program to the populations that you work with.
So hello, my name is Ashli Watts, and I am the Executive Director of a coalition in York County. So I'm going to do a healthy risk here and see if y'all are really listening, because I fear that I'm not a doctor like many of you are, but I feel that some of you have summit fatigue. I noticed your eyeballs, your head, you had desserts, you had a carb, you're tired. So if in your county there is a coalition, please stand up. If you know of a coalition in your county. Okay. All right. So now I'm going to ask you to do one more thing, because that's pretty impressive that there's a coalition in your county. And now I want to ask you, if you're a member of that coalition, I want you to do this. You are my people. Thank you. All right, you can sit down. Thank you. So I love what I do. I am one of the people in the world who is gregarious, and I got on every report card, Ashli talks too much. She'd be a great student. She talks too much. So guess what? I made that into a career. So that's called resilience right there. So our coalition, you see on this picture a lot of faces. We have a lot of fun. A lot of what we talked about is not a lot of fun, but we still do important work, but we have fun while we do it. We, as a prevention coalition, we engage students, parents, law enforcement, key members of our community, stakeholders, and we get them to kind of engage in the process of prevention firsthand. So we really tailor our coalition meetings, our events, everything that we do to really engage the community in fun ways, but also get information and prevention education out there. So this is just a tidbit of some of the things we do, from prom pledge to Narcan events, butterfly release that we have every year on our 5th annual, our talent show. And we usually have about 300 students and parents at our talent show, with about 60 of those who actually run the talent show itself. So we do a lot of events that increase resilience in our students by having them take a healthy risk. So I think it's important when we look at students who might be more risk to use, a lot of times those are students who like to take risks. They're risk takers. So let's give them an opportunity to take a healthy risk. So be a leader, be backstage at a talent show, perform a talent, do things like that. And that was actually something that our students thought of. So we actually have a very robust subcommittee presence. And one thing we do that really helps with that is we have a different person lead each subcommittee, and they report out at each coalition meeting. We meet monthly, and at those meetings, it's interactive. So instead of me talking about all the great things we're doing, I have a member of each of the subcommittees talk about what's going on. So we have someone from our AAT talk about our tobacco checks. And one great thing, so I know you know what a coalition is, so I'm going to highlight some of the questions y'all have had and how we as a coalition have been successful in addressing them. So we had Tall Cop come, we had all of our administrators from we have 4 school districts in York County, we had all of them come, and from that, what happened was those educators, they weren't mad that they had to be there for 2 hours, they were mad that people, they did a community scan, they were mad that people in their community were selling these products to their students. And some of them had grown up in that community and knew the owners of those stores. So guess what they did? They went to the owner and said, hey, Chuck, why are you selling this stuff to our kids? And you live a mile from the school. So, and you work a mile from the school. So those are some things that we've done as a coalition, is we've really engaged our members and empowered them to go make a difference, to talk about these things. So we educate a lot, but we also have a lot of interactive opportunities, because a lot of parents just don't know. A lot of educators don't know. So after we had Tall Cop come, one of the important things that we saw is we work with 2 drug task force. So out of our coalition, 2 of our VPs of student services have started drug task force in their school district. So what do we do in this drug task force? They do things like look at what are our rates of vaping in the schools? What are we doing to prevent that? How are the initiatives we're using addressing that? And so we kind of monitor that. And so that's one of the things that we do through that. So somebody mentioned earlier policy. I can't remember whose question it was. So our drug task force, we look at policy. So what are we doing when a student has a vape? What are we doing when they have a second attempt at vape? So we're trying to get them to move from punitive to restorative. So now we have a student who's caught vaping twice. That's an indication there might be some nicotine dependence there. So what we do is each of our school districts has a school-based addictions counselor, and they're referred there, and so they talk to them. And then one of our schools, the Clover School District, has also started a concealment room. So then while the student is undergoing that, the parent's going through a concealment room at the school and finding all these places that a vape might be hidden and other things might be hidden, and having a conversation with an intervention specialist. While the student's doing that, they're doing that. So we're doing some things that I think are kind of innovative, but I believe are really causing a lot of success. So we have 170 volunteers on our coalition. I am the only paid person, and part of my salary comes from donations from our school districts. So they are invested. They have members on my board, and they help with our initiatives. That's how we get students to our events. Trusted people in their school district get them there. So we have administrators, we have people on the superintendents that are involved in our coalition, and parents. So we're able to kind of use all of that together. So I don't want to bore you with each of our subcommittees and what we do, but I did want to just show you a couple things that have worked really well for us. On the far left, you'll see one of our students. She was in a media program. She's a digital media major. She got involved with our coalition and spent a month. She researched, she developed social media prevention. We referred her to some of your sites, and Truth Initiative and other things, because we make them be evidence-based, and we had her create posts for prom. We had her circulate those, because guess what? Not a lot of people follow York County. I mean, 1,000 of them, but follow York County All on Board on Instagram. But a lot of people are following her because she's the head of the senior class. You know, that's what I do. I pick kids who have a lot of influence, and then they're so proud of the work that they do, they share it. And they, and in fact, she just shared at our recent meeting her work with the coalition. And while she did that, we had just done prom pledge at her school, and she talked about the impact of having everyone come in and talk about risks, and then going into prom pledge and seeing her signature on the board saying that she was not going to make any high-risk choices that night, and what an impact that had. So that's kind of some of the things that we're doing. You guys asked about. Those are things that we're working very carefully with in our coalitions. One of the things that I like about meeting with administrators as well as parents is when we're looking at changing policy, we have superintendents, we have members of the school board who come to our coalition, and we're able to look at it and talk about it as a group before they bring it to the school board, so that we kind of look at how's a parent going to react to this, how are we going to explain this, so that we're making sure that we're protecting the student, we're really looking at restoration and not punishment, because nicotine dependence is a thing, and we want to make sure that our students who are struggling with that are getting help to prevent them from continuing to use. And a lot of our students, and this is a graphic story, but I'm going to tell you anyway, because I think it's interesting. We had a student intern who told us that she realized she was addicted to vaping when she was in the bathroom vaping. She dropped her vape into the toilet, and she picked it up and sucked the water out so that it wouldn't be ruined. So ask me if I think she has nicotine dependence. That's pretty serious, right? And she said it was at that moment she realized that she had not thought. I know moms, you're like, oh, gross. Like, I know, it's gross. But y'all, that's the truth. That's what dependence does, right? It takes us places we don't want to go. And so she said that was the beginning of her realizing that that was something she needed to quit. So, and she shared that story with me openly, and I was like, wow, you know, what a moment to kind of see to yourself, wow, I had not realized, you know. And yes, there's a lot of germs in a toilet, and I bet Amanda knows how many because she researches everything. But I'm thinking there's a lot. All right, so what about in York County? So we see a lot of what you guys are seeing in terms of on a state and a national level. We're seeing a decrease in vaping, e-cigarette use, obviously cigarette use. We're seeing a decrease, and you see it's progressing. We do a York County Student Perception Survey every 2 years, and again, we're seeing that decline. School districts are telling us when they're seizing vapes that they're seeing a decline. One interesting thing that our school districts pointed out, I would have never thought of, is that the first year after they got vape detectors, their amount of vaping infractions just skyrocketed, and a lot of kids were trying to evade that, so they have these great ideas of like the vape detector. Kids were trying to break the vape detectors, so their vape detectors take pictures, and then as the principal's voice comes over and says, "Hello, student. There is now a picture of you, so do not run. We are coming for you." So those are things that they do. So they have some creative things that they've been doing with that. But so the first year afterwards, the use increases, but now they're studying 3 years after the implementation of vape detectors, and those numbers are going down. Another thing that South Carolina has done that the school districts I work with say is extremely helpful is not allowing cell phone use during schools. So students are no longer able to text and meet up in the bathroom and sell a hit off a vape or do any of that stuff because they don't have their phones. They're not allowed to have them. I do school improvement counseling. If you're part of a school improvement council, I do a lot of education at those, as well as fairs and other things. But one of the things that one of the principals told me is not only that, if a student emails another student, they have software that detects certain words like vape and bathroom, and it goes to his email, so he meets the student in the email. So surprise, you came to meet Johnny to vape and you meet your assistant principal. So those are some things that our school districts say are really helping them with decreasing vaping. That's something I would have never known as a person in the community was going on. So this is a great opportunity for us to talk to parents, administrators, and figure out what's really going on. I also wanted to highlight Dr. Keeley has asked a question after every person. You know why that is? He is so engaged. He is retired, and his passion is to prevent smoking. He is Tobacco Free York County Coalition is a part of our coalition. He reports every time. They do some great stuff. He has great interns. He actually has one with him here. I highlighted some of their work from their Instagram because he works really hard on recruiting students. They do football nights where they engage students there. He has this great new what do you call that? A slide. What again? Retractable matter. Very fancy. I do not have one of those. He carries that to our coalition and sets it up. That was our last meeting. He works so hard to educate on policy, and that's just something I can't do. What I can do is engage community members. I can talk to parents. I can be available at events where we have back to school bashes to talk to parents about talking to their students about vaping. We work with a local treatment agency that does a lot of life skills. Somebody asked me about life skills. We're really working in our 2 drug task force to start life skill implementation earlier. So what does life skills involve? Not just self-esteem, but a lot about refusal skills. We want to engage these students in 2nd and 3rd grade with refusal skills, and then they all in York County go to life skills in 6th grade, but we're hoping if we start the basis of this earlier, those concepts will come back to them because we really feel like that 6th grade year is pivotal, but now a lot of schools are telling us 5th grade because of older siblings. Students are getting a hold of vapes younger and earlier because they're seeing older people do it, and we all know about that philosophy. That kind of follow that. So what happens with us locally? Now we address a lot of different substances, but I only focused on tobacco today, but we do prevention education all across the county. I love to speak, so every time I'm in a meeting, I offer a free prevention topic on whatever they want to study, whether it's trends, whether it's what's available for resources. I guide them to things like truth initiatives, quit vaping, Smoke Free SC, all of those websites. I feel like our job is more prevention, but we're steering them to different places for resources. So I would say if you have a coalition, I would love for you to share some of these techniques with them, especially the ability to do free. I mean, I talk to school boards, I talk to faith-based organizations, now non. I mean, anybody who asks me to speak, I'll speak free, and I'll talk on the topic they want. But I always talk about our coalition and our mission, which is to prevent youth substances in York County. And I have had so many people join our mission because we highlight that individual, you can do something. Each person gets a job. Everybody has the opportunity to volunteer. It's not me doing the work, it's all of us working on it together. And after our last coalition meeting, I had a parent who's also on our coalition walk up to me and she said, I just wanted to tell you, I enjoy our meetings so much. She was like, I love hearing about the progress that we're making in York County. And it felt great for a lot of reasons. It wasn't me, it was we have about 60 members at every coalition meeting, 30 to 60. But it was the fact that about 6 years ago, before I started, we had a superintendent say, it's just so depressing to hear all this information. And I thought, yeah, I mean, it's not encouraging to hear about our youth vaping and how dangerous it is, but it is encouraging to know that we're making a difference. We're decreasing that. In our county, we've had a large reduction in overdose fatalities, something else we're working on. So we're celebrating success at every session, as well as talking about ways that we can do a better job next year. How can we engage more people, more faith-based, more other agencies? And Prom Pledge is a great, if you don't have one in your community, get one started, and that's a chance they let me talk about high-risk behaviors too, so I get in front of a lot of students through that. They learn about our organization and our events, and then they want to come volunteer for us, so that really helps us too. This is our talent show that I talked about earlier. You see all these happy faces? Kids go to that, they learn about our mission, and then they ask me if they can be an intern. They ask me if they can volunteer next year. They start emailing me, hey, what else are y'all doing that I can be involved in? So our next event is our butterfly release on June 21st. Our students actually create artwork that we pay for the supplies, and they come out and we do a mass release and then individual butterfly release. So that's our next thing that we have going on. Again, brings a lot of students out, kind of engages them artistically. So those are some ideas. I know that you probably can't ask me questions now, but please write them down because I'd love to answer any. And thank you for giving me time. I appreciate it.
Good afternoon, everyone. Let me raise this up a little bit. Well, thank you for that shout out. I mean, that's exciting. So my name is Brianna Zimmerman, and I am an account supervisor for Rescue Agency. And I have the distinct pleasure to be one of the lead group facilitators for our Instagram cessation tool, which is called Quit the Hit. So I don't need to kind of belabor all the things that we've been talking about today already in terms of the specifics of usage and prevalence. We all know that that it is definitely an epidemic that is impacting our teens and young adults. What we have seen over the last several years is a decline in the use of in vaping use of high school students, but what we are seeing is that signs of addiction are on the rise. And so that's specifically something that our program is catered to. So the number of users that vape frequently is rising, but also the use of vape products within 5 minutes of waking up is something that gives you true signs of addiction. So what we're also seeing is that although with high schoolers usage is decreasing, with middle schoolers it is increasing, and that age with which they're starting is getting lower and lower. So the younger and younger that they are, that those numbers in terms of age are decreasing, but the usage numbers are going up higher. So basically, we are seeing that there are more products for teens and young adults to become addicted to. They are stronger, okay? So they're giving these signals to the brain that are making more teens and young adults want to use them, and they're cheaper. So they're easier to get to, whether they're getting it through a sibling or a friend who's older. They have more access than they've ever had before. So as we developed this program, and it's one that actually I've been a part of since the pilot program, and it actually was piloted in South Carolina with 3 groups that we started back in November of 2020. So what we started to realize is that, especially with teens, there's a major struggle when it comes to them trying to quit vaping. And so we have some firsthand accounts of, honestly, I'm not really sure why I vape. I just know I do because I'm addicted. I would say it's a stress reliever, but it's also the primary cause for my stress. I tried to quit vaping probably 12 different times. There were multiple times where I just kind of tried to ditch it. I don't think about it. And I'd always end up with another one, or I'd get one from a friend. And then, yes, I have vaped mostly because I was using it for my stress and anxiety. With school, sometimes stuff gets stressful. And some nights it's harder to sleep because I have all these thoughts constantly. I don't really do it for the effect it has on me as much as I do for the mood booster. So what do? We have to change behaviors. And one of the things that we do at Rescue Agency is we call ourselves a behavior change agency. We have to change the approach. And that was a lot of the reason why we joined with UCSF and Hope Lab to create the content behind this Quit the Hit program. We know that youth are communicating differently in terms of how we are used to communicating. I won't say, well, you need to meet them where they are. And what meeting them where they are means you have to go where they are. And so social media is where they are. And so when you have a tool that allows them to engage in the landscape that they're most comfortable, you're going to reach more of them, but you're also going to reach them in an authentic way to how they are. So we go from this concept of we need to keep them from vaping, but what happens when they've already started and you need to help them stop? They get stuck in this in-between of trying several times, whether they're trying cold turkey or having relapses where they're coming back to it. So what can we do to help them stay away? Quit the Hit was developed to help bridge the gap. For many people, calling a quit line is enough. For many people, texting is enough. But for some people, it's not enough, and they need something else that feels more authentic and more personalized to them to be able to help them on their journey. And it's not one that they can start alone. And for many teens and young adults, the idea of starting this journey alone can be intimidating, and it can be discouraging because you feel like you're going to be less successful because you don't really know what steps to take. You know you want to quit, but you don't know what steps to take in order to be successful with that. So Quit the Hit was developed with this in mind for small group support over Instagram group messages. So there's active group facilitation by a group facilitator with Instagram DMs that will consist of groups of 10 to 15 people. We found the sweet spot when it comes to number of teens or young adults because we want to make sure that they feel authentic peer support, but that it doesn't become overwhelming because you have so many voices speaking within the group. It is 5 weeks of active quit support, including daily cessation messages, as well as group challenges that we really want to ensure helps them develop lifelong quit skills and increase their confidence in quitting. So basically what happens is, and actually this next, we'll go with this one. So basically what happens is we run ads through social media, and each of the participants creates a profile on our website. Once they create a profile on our website, they do our entry survey, which gives us background information about their needs, their motivations, about their usage, where they are, and it gives us a good idea of kind of where they're starting from so that we know by the end of the program if we're actually seeing the results that we need to see. Over the last 5 years, we have had we have grown tremendously from just those 3 pilot programs in South Carolina and have reached over 5,000 participants with 382 groups across 8 states. And so this gives you some of the information about the different states, the numbers we have in these states, Most recently, we just started in Virginia. We just don't have those numbers out yet. But we, again, go with young adults and teen groups. We also do, in Minnesota, we have a LGBTQ plus component where participants get to choose whether they would like to be in a general group or an LGBTQ plus group to increase that level of comfort of being in the group with others similar to themselves. Through our research in our group facilitation, we've been able to see a decrease in 30-day vape use. And so you'll see the breakout between youth and young adult. As one of the speakers earlier mentioned, you definitely want to make sure that you are separating the teens from the young adults. So that's why we deliver this in separate graphics. But it gives us an opportunity to really see whether their usage is decreasing. We do an entry survey that happens before they join their group. The very last day of the program, they get an initial follow-up that gives us an opportunity to see how successful they've been in reducing their use once the program ends. And then we do a follow-up survey that happens 30 days after that to see if they've continued to see that success or if they need additional support. One of the things that we saw, and obviously some of the other speakers have spoken to that too, is that there's dual use. And so it's not just about vapes, it's about the other products that they're using as well. And a key component of our program is that even if they are using several products, that they not decrease vape and increase another. We really want them to reduce all usage in order to be successful. And as we talked about quit confidence earlier, it's really important that they feel authentic support in knowing that they can quit. And so what you're seeing are these numbers from the baseline survey when they first begin the program, before they've even had an opportunity to speak with me or one of the group facilitators, and what those numbers look like once they get to the 30-day and once they get to the 60-day. So I want to share with you some of the testimonials from participants that have gone through our program to give an idea of what it has felt like for them. I feel like this group helps a lot because we're all struggling with the same issues. It's nice to feel like you have people in the same boat to help you go through it together. And this was a teen participant in Kansas. And a young adult participant in Minnesota said, "This group has been helpful as a safe space I can go to talk about vaping, knowing that everyone here has the same intention of quitting. I'm also really glad that I can refer the group to others because this program reminds me that I'm not alone and that I can get help quitting." And then in Oklahoma, there are multiple times I was very tempted and I had to call on my peers to kind of help me get through. Hey, what's working for you guys? My cravings are getting super unbearable right now and I just need a little bit of help. Part of the goal of the program is that not only they are receiving authentic peer support, but that through live facilitation, you're getting questions answered in the moment. You don't have to wait on these questions. You get adults who are there to be a support system as well, but also the point of the live group facilitation is also to make sure that the conversations are going in the direction that we need them to go, that there's not misinformation, to make sure that everyone is treating everyone accordingly, that they are staying to the community norms, which is something that we discussed in the first week of the program, and honestly just to help them grow in their in understanding that it doesn't have to be a journey that they have to go through alone, that through their peers and their live facilitator, they're going to get the individualized support that they need. And so when we asked some of our participants about what it felt like to have and lean on live group facilitators, they said, well, in South Carolina, thank you for giving me a second chance at life. And in Kansas, I've been able to slowly manage my life better. Step by step, and seeing results not only makes me feel better about myself, but also encourages me to keep going. Since starting the program, I felt support from you, the group facilitator, and sometimes that's all I need. I will tell you, as one of the live group facilitators, the connections I've been able to make with the teens and young adults has been tremendous. There are times where they are going through major battles. major life changes, whether it's having kids, whether it is graduating, whether it's a breakup, all the things that are going to impact these stress levels and make them want to turn to their vape, but they have me and their peers in their group to help keep them from doing that. So, as public health advocates, we're not just observing, we're innovating. It should be our mission to meet youth where they are and transform health behaviors into choices that are accessible, engaging, and life-changing. Thank you. And if you want more information about Quit the Hit specifically, you can use the QR code listed on the screen.
All right, so we'll have time for questions.
Done work trying to call out differences between rural teens and urban, suburban teens, or is that another group?
So we've participated in a lot of different programs and research within Quit the Hit specifically. It depends on the program because some of them are statewide, and then some of them are just in certain cities. So, for example, we have a partnership with San Diego Unified School District, and it's not statewide, but we do have a randomized control group that is in the larger part of California, but most of our programs are statewide.
But with your Instagram project, you really don't have any idea where in the state people are?
Yes, so that is a component of what we look at. What they do when they sign up is we get their zip code, and so we're able to map out where we're seeing the most prevalence in terms of not just usage, but also participation.
Well, I'd be curious if you haven't already, maybe look at South Carolina by zip code and see what happened. When you did that project, the 600 and some folks. Mm-hmm.
Absolutely, that's definitely information I can share with you because we have it for all of our programs.
I'll send you an email.
Perfect.
Ashli, great presentation, by the way. One of the things I saw with your coalition is you cover many substances rather than, the substance of the week. It's vaping or, cannabis or whatever. I think that's a really good idea. Could you comment on that as a way of building a coalition? Because I see a lot of, we're tobacco, and that keeps a lot of other groups out.
Well, our coalition was actually started over 20 years ago by a school board member, and I think the Drug Free Communities grant is what originally funded All on Board, so that kind of targeted substances. And we just, based on our student surveys, opioids was a no-brainer when the epidemic hit. We knew we had to address that. But I think we have recognized that students who are at risk for use, it's pretty much like it might start with vaping, but it's pretty quickly going to progress to something else, especially with THC vapes, which school districts, we have lots of discussions about that, testing it. Our DEU talks about that. So I definitely think that when you're looking at substances, nicotine is very important, but the fact that we cover kind of all aspects really engages more of the community. One interesting thing that I was going to point out, so I did have the job, I worked at a local treatment center and I supervised the withdrawal management and residential program. And we had a big push to make that campus nicotine free. And there were people who were begging to get into treatment for opioids, but when they found out that there was a possibility they were not allowed to have nicotine, they said, no, thank you. So that's kind of interesting, isn't it? That we're working with a population that has multiple things that they're coping with. And it really has to do with a maladaptive coping mechanism as well as a lot of other things. But yes, that's why we do that. We do reach more people that way. And we find parents, once they're engaged in the coalition, whether it's from a child who's struggling with opioid use or marijuana, they're very much engaged in helping our prevention efforts no matter what. Absolutely. It's just a little easier to sell with parents that you're starting with vaping than the other. Does that answer your question?
I have a question about the youth coalition as well, or the York County coalition. Last week at MSC, we had a researcher talk about predictors of smoking in youth instead of vape. And they said that one of the biggest predictors is how they see themselves in relation to their peers. and they talk about, they said that low self-esteem or seeing themselves as like not popular or like an outcast is a predictor of smoking. Do you see that as a predictor of vaping or other substance use?
I work closely with a lot of people who teach life skills in the school districts, and self-esteem, they use BOTFINs, which is the evidence-based curriculum, but a lot of what they work on is self-esteem. And yes, a lot of students want to be included. They want to be a part of that. In fact, we had one of our officers on the drug enforcement unit said his younger brother was in middle school, and of course he had told him so many times, you're not to do that. You know, I think all of us, when we work in this field, our kids are like, oh, my mom's a narc, you know, like totally. But he said that the thing that his brother used to say all the time, but all the kids do it together and they talk about how great it is. So definitely, I think if your esteem is not built so that you're a leader and you have strong refusal skills, it's going to be hard for you to say no to things like that. So I definitely think that's true. I don't have evidence of that, but anecdotally, certainly students on our coalition tell us that it's hard when a group of people. But I will say the tide is turning because a lot of students who work with us are mad because they cannot go to the bathroom without there being vaping in there, and it makes them mad. They don't want to go in the bathroom and smell vapes or have the vape alarm go off every 5 minutes. I remember my children saying they couldn't go to the bathroom all day long because there were people in there vaping, and with that came a lot of other things that were negative kind of aspects as well.
Awesome, thank you.
Hi, thank you so much for that. I'm Martha Shocker, I'm a pediatrician in Fort Mill. And I think my biggest question is, I just have the hardest time sometimes getting kids to buy into some of these because there's so many good resources out there. I've given them This Is Quitting, I've given them all those. And I actually have the 1-800 smoke-free quit line little prescription pads in all my offices, and I give them out. I had a patient last week who I saw on a Saturday, which was a Thursday, and she's 19 years old, asthma exacerbation, but yet she's vaping every day. So I said, come back on Thursday, I'm going to spot for her, let's talk about it. She didn't show up, and so that kind of is, I guess, my barrier to taking care of the kids, not being able to address it in the moment, and then not putting them back in. Do you have any recommendations on how I can approach that? For anybody?
I feel like a microphone hog. I think that, well, first of all, we can't change anyone. I know that's a hard thing to do. We can make resources available, but I think what we do is we just try very hard to educate the parents earlier on. So I think your parent is your best advocate there. So our student perception survey looks at what students' perception of their vaping is. What are other students' perception? What are parents? And what we're finding is that more and more they're finding that other students look on it negatively as well as their parents. And that is really where we're coming in with education. So it's very frustrating. I think keep having those resources available. Don't get discouraged. There are ways that they're being reached. We have an agency that uses a lot of geofencing, which some of you are aware of, very effective, where a student just goes to a certain place and they get ads from that are prevention related. So I would say give it time. You know, sometimes it might take 3, 4, 5 interventions for someone to make change, but think about a behavior you've had that was unhealthy. Maybe it wasn't the first time the doctor told you were a little overweight that you said, oh, not you, I'm speaking about myself, that you were like, hey, I'm not really, I just have on heavy shoes. It takes a couple times. So I would say don't be discouraged. Keep going. Realize that these interventions do work. It just takes time. We didn't see a reduction in the overdose numbers for quite a while in York County. It was very discouraging, but then you start to see those initiatives take effect. So don't give up. I would say keep using your enthusiasm and all these things that you're using. They are going to take, and keep learning at things like this, because it gives you new interventions that I'm excited to take back to my coalition. So.
Okay, great information. One last question.
Thank you so much to all three of you. My question is related to the use of social media and looking at the impact of each one of those. So, Megan, Brianne, I'm looking at it from the data side. I mean, we're looking at traditional ads and those kind of things, but with social media, it's now like the number of clicks, the number of people who've advanced to the website, completed videos. How do we actually use those kind of information to actually show impact, that what that ad is or what that program is doing is actually having a positive influence and like moving people towards cessation or something like that. And how do we explain that to a community who may not understand the intricacies of like, you know, like how social media works? Thank you.
I don't know if she can.
We're not sure she can hear it. Megan, could you hear that question at all?
No.
Sorry, I wasn't thinking. Rajiv, do you want to come, or do you just want to tell it to me, and we'll play telephone?
I'll say in the meantime, in terms of our particular program, because we are registration based and enrollment based, it's a little bit easier to be able to see that impact because we're not just going for impressions and clicks. We're going through people moving through the website, moving through the program. And so once we are able to give those numbers in terms of participants that's going through the program, that's what we use as our indicators for success. But you definitely, and I wish I had had a slide in there just showing some of our ads and how we have done testing to see which ads pull the most click-throughs to our website and help us be more successful in getting our point across. We are an incentive-based program, so our participants do get an opportunity to earn incentives, well, Amazon gift cards, to move through the different steps of our program. And we see that those monetary ones are definitely ones that get people through the process, but also ones that just talk about getting certain types of support. And we have tailored our ads to just be more inclusive, be more representative, and also speak to some of the big themes that have come through our programs to where when teens and young adults see them, they're more likely to want to engage.
Okay. Hey, Megan. My name is Rajiv Mawat. I work with the surveillance and evaluation for the Department of Public Health here. So a lot of the things that we're dealing with obviously is the impact of the programs that we have and like how we engage the various communities. But we're really wading more and more into the social media aspect where the language is the number of clicks, the number of people who've successfully gone to the website or completed a certain program. So I was just wondering, like, how do, like, for people who are entering that, and also to explain to the community at large who may not understand, like, the new lingo and so on, what does it mean, like, you know, like when somebody, like the number of people who've clicked, or how does that, like, really measure impact? So that's my question.
You're right, there is so much data available, and some of it matters in different ways. So when it comes to engagement with our promotional media, whether that's video view completion rate or click-through rate from an ad, you know, certain things we look at just to evaluate how well creative content is performing at reaching and engaging eyeballs as a marker of whether or not we need to rotate out our creative assets and bring in new different creative, you know, to refresh the creative. So if video completion rate, for example, starts to drop, that's our signal that it's time to get new videos into the rotation in our media mix. Video completion rate is not a marker of enrollment, right? For that, we need to start looking at different metrics related to ad click-throughs and completion rates on form fields within the campaign landing pages, or we need to look at text in rates. So each of our creators, those influencers, get their own opt-in keyword. So Katya, for example, promotes text join Katya to 88709. And so we can map how many people are enrolling as a function of Katya's creative specifically. We can look at the dates and timestamps of when people are coming in based on when certain posts of hers are trafficking and when she's posted them. They're pretty consistently spiky, right? When she posts within a 48-hour period, there's a blast of users who come in that use her keyword. And so we're able to map how successful some of her posts are, or any creator, you know, with sort of mapping it against that enrollment pattern. For our general campaign, though, the Outsmart Nicotine campaign, that's all using text X program to 88709. So we're not able to map which exact creative spot drove more keyword opt-ins. But we see that the keyword opt-ins comprise roughly 25% of our total enrollment traffic. The other 75% comes from web forms, meaning in-app forms. So there's different types of media that you can run on platforms like TikTok or Instagram, where users can enter their phone number right in a form on an ad on those platforms. And so we look at the completion rate of enrollment from that. And then we also look at how well our campaign landing pages perform for ads that drive to a specific landing page, which in this case is join.xprogram.com. We can look at which ads we have tracking that goes all the way through. People who clicked on a specific ad that they got to the landing page, but the completion rate on enrollment was lower. So even if the ad is performing well in terms of video completion rate, but when they click through, they're not enrolling in the program, we might evaluate that ad spot differently and rotate it out in different ways. So there are lots of different metrics that give us indicators of how well a piece of content is engaging with audiences, how many likes and shares or bookmarks it's getting. On TikTok, for example, you can save content. So seeing how much a piece of content has been saved or shared, that's one indicator that content is working well, but then the other is the actual path all the way through to enrollment. And so we try to track that as much as possible.
Thank you, Megan. Thank you to the rest of our panel for sharing your great information.